Alors bonjour à tous.
So hello everyone, dear colleagues. Happy to be with you again and welcome to this press conference to go over the situation in Quebec in relation to COVID-19. The Premier of Quebec, Mr. François Legault, is together with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health of Quebec, Dr. Horacio Arruda. Mr. Premier, thank you very much. Good day, everyone. First, the mask that I am wearing today was made by a company from Quebec called Sur Mesure and who also makes ties with the rainbow colors for hope, the Ça va bien aller. So let's encourage our Quebec artisans who make masks and let us wear masks. To be a little different, we started this morning publishing the numbers, so I won't repeat all the numbers that you already have. I'm going to go rather to some comments on the general situation. So, of course, the situation remains difficult in CHSLDs. There continues to be many deaths. The number of people who have been infected has decreased, but the situation does remain difficult with the staffing. I'd like to remind you a little bit of the sequence of events in CHSLDs. For many years now, there were about 10,000 employees missing in CHSLDs in order to have what I would call reasonable ratios. So when we arrived as the government a year and a half ago, we increased the budgets, and unfortunately we did not succeed in filling those positions. So we did post them, but we're not able to fill them. Our objective was to, during the bargaining of the collective agreement, which started, although it's not yet signed, on the 1st of April 2020, to significantly increase the wages, amongst others, of orderlies in order to be able to fill these 10,000 positions. And I've said it already, I'm repeating it, if there's an error that we made in this year and a half is that at the same time as we increase the budgets of CHSLDs, we should have also increased the wages of orderlies in order for the budgets to be spent, because we ended up in a very strange situation where there's hundreds of millions of dollars that had been budgeted for that were never spent because we were not able to recruit the necessary orderlies in particular. And then arrived the crisis. And because of the crisis, another 10,000, a further 10,000 employees were no longer at work, either because they had COVID-19 or, in certain cases, they were scared of catching COVID-19. So now they're starting to come back. We're at about 9,700 missing people right now, but it remains that we were missing 10,000 employees already before. We were trying to fill those positions, particularly, with part-timers, which explains why half the employees are part-timers. And then to be able to replace the 10,000 absentees, we used two different means. First, the Je Contribue website, so people who didn't necessarily have training, but who accepted coming to work in our CHSLDs, and also the soldiers from the army. And I did speak with Justin Trudeau this morning. I asked that these 1,000 soldiers remain until the 15th of September, and I'll talk about it later, but that'll give us time to train employees to be able to fill the positions that are missing. So, the second 10,000 employees that are missing was filled temporarily by people who were not trained. And now we hope that in the next weeks and months, those 10,000 employees will be coming back to work. But we still have the first 10,000 missing that has been missing for years in CHSLDs. The problem remains whole in this case. So over the next few days, we are going to be launching a large-scale campaign to convince 10,000 people to register to get training to become orderlies. So this is going to be done in many dozens of professional training centers, in part in the field as well. What we want to do is to recruit 10,000 people that would accept following that training, which will last 3 months. So that is from mid-June to mid-September. The people who will commit themselves will be paid during the training. So they will be paid as service helpers. That is $21 an hour, $760 per week. And if they succeed their training after 3 months, they will get the new wages, which we are giving either through the temporary premiums or that we offer in collective agreements, which start at $26 an hour. So $940 per week, $49,000 per year. So I think that this is interesting as an offering. And it is also, of course, a lot of people are saying it's not just a question of wages and of numbers and of money. It is something that is gratifying, that kind of work, to be able to care for the vulnerable people in our CHSLDs. And it has to be understood as well that we will be setting up a new context. First, by adding 10,000 people who weren't there, that means that we will have more people to do that work. So it'll be more pleasant with those 10,000 additional people. Also, we wish to have a look at, and we've talked about it already, but renovating CHSLDs, building new homes for the elderly that are going to be bigger, more beautiful. And I was saying it already to those who had asked me the question, we are not excluding, if 10,000 employees is not enough, we do not exclude increasing the ratios more. We don't exclude that, but we agree that we already have quite the challenge ahead of us to find 10,000 people who will come work full-time. So 10,000 people more in our CHSLDs. So we will tackle this challenge before we change anything in collective agreements. We do have to be able to deliver on this. But I want to be very clear. I am not excluding going over 10,000 if it is necessary, but we wish to offer all employees in the future in CHSLDs working conditions that are pleasant, having time to be able to speak with the residents. Perhaps even change the names. The French name, préposé aux bénéficiaires, is not something that we like. But these are real people. We want to have the time. It's just as important, that part of the work, that of having contact with the residents. It's not just, the medical aspect of it. So, everyone, get ready. Over the next few days, we will be giving you the addresses of the 40 or 60 professional training centers that are going to be accepting people. So it's going to be from mid-June to mid-September. But it's going to be a beautiful experience. So you saw that we had a report from the Army. Not many surprises in it, which does not mean that the situation is not difficult. But what struck me the most are two things in the report. And the reports, because they did make a small report on each CHSLD where they were involved. So two things stick in my mind. So, of course, the fact that we're missing 10,000 people means that we have, and that we have also a lot of people who are part-time. That means that it's very difficult to make sure that it not be the same employees that are in the hot zones and in the cold zones within a same CHSLD. That's what we're targeting, and I think that we succeeded with the people from Je Contribue and the soldiers who arrived. We managed to limit that, but it remains that this problem is something that we are aware of, and you are aware of it, so it is important to add staff. And when there is a hot zone, well, that it be staff that is specific to that zone who work there. The other problem that was raised, and this is also something that we were expecting, is the use of personal protective equipment. So how and when to wear a mask, a gown, gloves, when do you have to change equipment when you go from one resident to another. Even the military personnel had to adapt themselves, and unfortunately some of them got infected. But of course, if we had 10,000 people, or by having, rather, 10,000 people who were not qualified for most of them. Some people were people who were retired and who came back. Well, it's a lot more difficult to have the guidelines be applied, on to wear the PPEs. So I would say that those are the two things that come out a lot. We didn't have anything like in yesterday's report in Ontario. Now, another subject that I want to talk about are the comparisons with other places in the world on the number of deaths in Quebec. First, I think we must be very prudent. We've seen it, and Dr. Ruda showed it as well. In Quebec, all people who died from COVID-19 were declared. When we look at the surplus of deaths compared to the same period last year, we see that it's about the same number. So that means that here, all deaths were declared. So you saw articles all over the place in the world where they were saying that in certain places, it's only half of the deaths that were reported. And once we have all the numbers on the comparisons of deaths in 2020 compared to 2019 and 2018, that's when we'll be able to make those comparisons. So that is the first thing where one has to be prudent. And the second thing where we must be careful is that the virus hit a lot more in the large cities of the northeastern part of the U.S. as well as the great European cities. And when you look at the large cities of the North American Northeast and most European cities, we have a number of deaths per million inhabitants that is comparable in Quebec, even in certain cases worse than in Quebec. So I'm talking of cities such as New York, Boston, Chicago, Detroit, Philadelphia, Washington, D.C., London, Paris, Madrid. If you go look at those numbers in those cities, it's all comparable or worse to what we experience in Montreal. There is one exception, and that is Toronto. Toronto has a lot fewer deaths per million inhabitants that have been declared. And I launched a challenge to Dr. Ruda and also to the INSPQ to explain to me why Toronto, because Toronto is also a huge city, why the situation is completely different from the other great cities in North America, in the northeastern part of North America. So I present you with this challenge, and those specialists, the people who know, will let us know. I would like to end with my daily thanks. My daily thanks are the people from Je Contribue and the military personnel. I wish to say thank you. Thank goodness we have you. And I want to send out my message as well. I would like for the military personnel to stay until mid-September. I know I talked about it with Mr. Trudeau. It's not easy. They have other missions. But I can tell you that all the comments that we've had on the military staff is that there was exceptional collaboration between the healthcare staff and the military staff in the CHSLDs. So we would really like to keep them until mid-September, so that it gives us the time to train the people that will be training this summer and that they are available to replace them. So, last thing also that I want to say, I know that a lot of people are really looking forward to us going faster in the deconfinement. I'm thinking of all the gatherings, whether it be family get-togethers or friends, inside, because we've allowed it outside. And I know that there are people who are saying, well, when are we going to be able to get together again, 5, 10 people amongst friends? And I also know that in the art world, there are people who are really looking forward for us to announce a date for shows, even if there's a third or a half of the spectators. And I'm telling you right away, it won't be tomorrow. And the condition that we need to get to that next step is really to control the spread of the virus. So we have to succeed with what we've announced. So external gatherings of 10 people max, the reopening of businesses, which started on Monday in Montreal, that cannot bring more cases in hospitals. So if we succeed in that step, then we can hope going back to inside gatherings, of course, with guidelines, It's not going to be entirely like before, but it is important to respect the guidelines if we want to get back to a more normal life. So I count on all Quebecers to succeed with that step of the businesses and external gatherings, outside gatherings, so that we can then talk about inside gatherings.
Good afternoon.
English?
Our biggest challenge remains the staffing situation in our health network, especially in senior zone. We still need more people. In the coming days, we'll launch a campaign to recruit 10,000 people to receive orderly training. I ask every Quebecer that can to consider it very seriously. You'll be paid $21 per hour to follow the training of 3 months. And once you're trained, you'll get a full-time job at $26 per hour. That's $49,000 a year, including plus the pension fund and all the fringe benefit associated with the government. And we're talking, and that's important, about a rewarding job that makes a real difference in people's life. So I ask you to consider it seriously. We need you. I want to remind you also that all that will be possible, that the return to more normal life will be possible if we follow the public health instructions. So we must keep our distances and wear a mask. I'm counting on you all. Thank you.
Merci, Monsieur le Premier ministre. Alors, pour la
Thank you, Mr. Premier. We will now start with the French question period. Mr. Premier, how would you describe the usefulness of the Canadian Armed Forces report for your government, but as well for the federal government, to whom I imagine it was destined, first and foremost? And do the Canadian Armed Forces, did they go beyond their mandate by gathering information and by creating this report for the federal government? I think it is in the habit of the Canadian Armed Forces, when they have a mandate, whether it be for floodings or anything else, that they have a report at the end. Okay, we're not at the end, or at least I hope that we're not at the end, and that is what I said a few times, at least 3 or 4 times this morning, to Justin Trudeau. We could have learned things. What I saw yesterday is that Doug Ford did learn things with those reports. What we are learning is that we're missing staff because the staff is not trained. They have a hard time with the individual equipment, the PPEs. So I didn't really learn anything in those reports, but it's a way of doing. This is how the Canadian Armed Forces function. And that help from the Canadian Armed Forces is very appreciated by your government, since you're asking them to stay until the 15th of September. Has Justin Trudeau said no? And also, you're talking a lot about pride since your election. Isn't it a little embarrassing to have to count on the Canadian Armed Forces to maintain the CHSLD network in Quebec from sinking? I think it's a judgment that we have over many years that the CHSLD has been neglected. To say that we went into this crisis with 10,000 employees missing in CHSLDs for the past 5 or 10 years, that's embarrassing. Of course, it's not easy to find 10,000 people who are disciplined and who accept right away coming to work in a context that is not easy. So that is why I'm happy that out of those 10,000 people, 1,000 of them were military personnel. So I think that it is embarrassing for the Quebec society that we are at this stage, that of needing 10,000 people. We should have done it much earlier, as I said, and I repeated. We took a first step by increasing the budgets for CHSLDs, but we should have increased more quickly the wages to fill those 10,000 positions and not end up in a situation where we needed the military. Mr. Premier, I'd like to get back to this aspect of the report concerning the wearing of PPEs. You said that there's an absence of training of new employees, but still, the report is a little bit stricter than that. We're talking about, lack of disciplined employees who don't follow the guidelines, lack of leadership from the managers, problem with prioritization. So is it normal that some employees not know how to use PPEs and the Army has to substitute itself to the managers to establish the organization of care and training? It does seem to include a very important or indicate a very important leadership context. Well, taking into account the context, 10,000 new employees that we recruited, that includes the military, people who did not have training, that did not have the experience. So it's very difficult to apply guidelines when we have so many new employees without training. And unfortunately, there have been employees, including soldiers, who were infected. And Mr. Premier, just to add some information to that, it has to be said that even for the employees who were already there, who have knowledge for infection prevention, with COVID-19, CHSLDs are living environments, and they became caring environments of healthcare. It changed everything. And the protective equipment, yes, requires training, but continuous training. And it even requires that there be two people when you put them on and remove them. So that is why, once again, it's so important to have more staff. And we have an entire program that we set up because since the beginning of the pandemic, there's even the Red Cross that helped us out for the prevention of infection. So we're setting up an entire program for the past few weeks that is going to go to all CHSLDs. The report is instructive out of 10 CHSLDs, but all CHSLDs, we already started training, very, very stringent training on the prevention of infections, and that will be continuous. And we're going to have more people as well who are going to take care of the prevention of infections in those establishments. And that is fundamental for now and the way that things will unfold. We heard the Premier, Justin Trudeau, earlier this week evoke the idea that we offer employees 10 days of paid sick leave so that people don't feel that they have to go to work if they have symptoms. Mr. Trudeau as well was questioned on a possible involvement of the federal government in the care to give to elderly people. Do not close any doors. What role do you see the federal government play in the longer term beyond the temporary presence of the Army in the care for staff? If you do see a role for the federal government. Well, I told Justin Trudeau this morning concerning that the sick leave that there's a very negative reaction on the part of businesses. Of course, there's a question when it's not clear who's going to be paying for that, but there's also a question of work organization in a context where already companies are in a very difficult situation. I understand the objective. The objective is to make sure that an employee who has symptoms does not feel forced to go to work to be able to get their pay. I understand that objective. But it's probably going to be debated. That is what Mr. Trudeau said. So tomorrow evening, Thursday evening, so at our meeting. As far as funding is concerned for long-term care, well, I said it many times to Mr. Trudeau. What I suggest is to increase the federal transfers in health, because when we started, it was 50% of the health funding that came from the federal, and now we're at 23% only that comes from the federal. So that is a very heavy burden on the budgets of provinces, because the budgets in health have increased more quickly than inflation in pretty much all the provinces in the past 10 years. So it's unfortunate. And on top of that, we want to cut growth from 3 to 5%, whereas, with the new medication, the new technologies, and people getting older, there is an increase. So for the same services of about 5%. So we're going to pressure very much all the premiers of all the provinces so that if truly the federal government and Mr. Trudeau wish to help to fund the long-term care funding, well, that they should increase the transfers, federal transfers to the provinces. You're saying that the training plan, which is 3 months, is for 10,000 people. That's fantastic. It took everything, however, to find 10 people. It won't be able to be the same 10 people because they're already working. Where are you going to go and find those people? It could partly. Anyway, there's a part that could be in those 10,000. We're a little concerned that those people leave too quickly because some had other jobs. Some lost their other jobs, but it will be part of the people to whom we will be offering, to say we're going to pay you during your training for 3 months. There's a part where we are creating, with Jean-François Roberge, what percentage will be done in the professional training centers and what part will be done in CHSLDs. So it could in part be those people. But yes, in fact, it is a huge challenge. I've asked my people to set up a big promotional campaign. And I think that's saying as well, we're giving you $760 per week for the 3 months of the training, and after that, $940 per week to start. That is, $49,000 per year. I think that that's a good proposal. Now, our challenge as well is to increase the image of CHSLDs and to say, with those 10,000 extra people, well, the work is going to be more pleasant. We recognize that there are CHSLDs that are obsolete, dilapidated, that have to be embellished, replaced by homes for the elderly, renovated significantly in other cases. That is the challenge that we have of recruiting in a context that is not easy. You just received the Army. The Protectrice du Citoyen said that they would investigate. Is that good news, and is that enough? Well, that's a question that we are asking ourselves. I had already said that I was open to an inquiry or some kind of an investigation on what happened in CHSLDs. Is that enough? What will be done? Well, it remains that the problems are known. First, it's the 10,000 missing employees, but we are not excluding anything at this stage. I do want to look at the mandate. Mr. Premier, you just answered my colleague saying that you wanted to draw 10,000 people. That is an objective, to employ your terms, that is very ambitious. The military personnel, you are asking them to stay until the 15th of September. How are you going to face this second wave if you don't have the 10,000 people and the military is gone? Well, that's a challenge that we have. We hope that if there is a second wave, it won't arrive before the 15th of September. And of course, in the meantime, I do hope that people from Je Contribue and the military staff are going to stay. And we also hope that the 9,700 employees that are absent, 9,700 employees who are absent, will come back to work as quickly as possible. That is what we are trying to depend on for the second wave, the possible second wave. That is also why we want to give vacation to people who are working right now. And, we want to give, that's what we're planning on, giving a 2-week vacation for everyone. So that is going to be really important so that everybody is more rested to come back and help us in the fall. Concerning the air conditioning, somebody launched a warning at the office of your minister responsible for the elderly, and that person confirmed today that there was a political advisor who had told her, even if we put air conditioning, people are still going to complain. That's not an answer that is acceptable, but what I would still say, a couple of things. First, the majority of CHSLDs and residences have no case of COVID. And in all of those residences, there is a common area that is air-conditioned with an area of coolness. That is what was planned for before COVID-19, that on heat wave days, during the day, patients could be brought to that zone. Now, the indications, the suppliers that proposed themselves to go and install things in the middle of the crisis a month ago, well, there were 2 good reasons not to accept it. The first one is that we didn't want the virus to to come in. So it wasn't time to have people come to install things. And secondly, the guidelines from the public health authorities and the INSPQ weren't clear to know whether that wouldn't create an additional greater danger than using ventilators or fans or air conditioning. So on Monday, we had the okay to say there's more advantages than disadvantages. So in those residences where there are cases of COVID, so where we cannot or it's more difficult to use the common areas that are air conditioned, we are going to be quickly installing things, but we will do it prudently.
Monsieur le Premier ministre, je vais revenir sur le rapport.
Mr. Premier, coming back to the Army's report, why is it that we, in certain CHSLDs, we once again have an insufficient quantity of PPEs? That's a good question. It is true that at the beginning, well, first, what is important? In total in Quebec, I've followed every day since the beginning of the crisis, we never had a lack of equipment, whether it be gloves, gowns, masks, surgical, N95. We never missed any. But at the beginning, there was a problem with the distribution, particularly in the private establishments. So they weren't raising their hands to say, you know, we don't have enough equipment. So there was a distribution problem. I dare hope that this has been fixed. Did you want to add anything, Danielle? Well, of course, in the report, there are a few places where there's probably still a problem of a logistical nature, and it's being fixed right now. But what I noticed in the report is more how the PPE is worn. That is the problem that was raised. And of course, that is also has to be fixed. And that is why we have teams that are training and that are following those establishments. But in terms of the availability of protective equipment, we have everything we need. And we did lately send very clear rules, visors, masks, gowns in all CHSLDs except those that are in cold zones outside of the MCC, of the MMC. So everybody in CHSLDs has to wear that equipment. So if the situation, if it's still presenting itself, we're looking to it. The military are not supposed to be administrators of the establishment, but they did see that in many places there were obviously management problems. You know, and now we're told that managers, because they're managing 2 or 3 establishments at the same time, the guidelines don't make it the way down. They clearly saw conflicts on the management of schedules, and there were even internal bickering. So what lessons do you draw from these conclusions, and what could it make you do? Well, it's something that I've already said a few times. The cuts from the former governments in management. It's true that there was perhaps too much bureaucracy, and a part was normal to remove, but perhaps it was overdone. I think that each establishment should have a boss, its own boss. You can't have a boss that is the boss of 3 establishments. That's going to be part of the changes that we're going to be bringing in the next few months. But it is something that we already knew.
Geneviève Lajoie, Journal de Québec, Journal de Montréal.
Bonjour. Je vais vous poser une question sur...
I'd like to ask you a question on another subject, Mr. Legault, since we didn't have the time to talk to you about other subjects today. How are we going to know what the shareholders are going to do with the $200 million US that you are granting to the Silk, and how is helping the shareholders, how does that help Quebec? Well, that is not a simple file. It's complex, and I think that the proposal that we made is brilliant. And it's not me, it's Mr. Fitzgibbon mainly, but what we're doing is we're telling the shareholders, first of all, it's important to bring back control, you know, at some point to Quebec. That's important. And now there's going to be people who are going to be making offers to the creditors because there's a lot of debts. The debt has to be reduced, and it will be up to the creditors to decide what offer they take. Are they going to take ours, or are they going to take that of other people who are probably going to make a proposal? Now, we wanted to make sure of 2 things. First, to bring back control, that we keep the headquarters in Quebec, that we also make sure that we prioritize the 1,500 jobs that were there before the crisis, so giving those people back their jobs. And also, we wanted to make sure that our amount would be protected. So it's important to know that this is a loan with interest. That is done, and now we can't go too much into the details, but it is made in such a way with the shareholders where our money is protected. It's a loan. It's not a subsidy of 200 million. Now, if we are the ones who win the offer on the part of purchasers, we'll be able to discuss Mr. Péladeau, Mr. La Liberté, all the Quebecers that could be interested in purchasing. Well, Investissement Québec will have as a proposal that makes it that we have an option to take control of the Silk based on the benefits of the upcoming year. So that means technically, if they're high, we'll pay more, and if they are not, we'll pay less. I think that's a good agreement that will be able to be ceded to a Quebec group eventually, but now we're giving the possibility to shareholders for a few years to show us that they are able to bring back profitability to the Silk, and the amount that they would receive in that purchasing option would be proportional to their success. So I think that it's a win-win situation. We give them a few years to succeed. If they do succeed, they're going to have a good price. If they don't, they won't have a good price, but we'll get a good deal. And we'll bring back control to Quebec. But I can't go any further than that. Mr. Arruda, when you give an authorization to deconfine of a particular sector, is the announcement made automatically? That is to say, do you let the government decide when those announcements are made? Usually the deconfinement announcements are discussed in the morning or validated the evening to be announced the following day. There's not a lot of delay from what I've understood. If I recall correctly, the deconfinement is done by order of communique, not necessarily announced here. It's done with the Director of Public Health as well. But if you'll allow me, does that answer your question? Yes, but give me an example with camping, for example. When was that decided? Oh, the decisions, very honestly, the final decisions, because, we have to be quite clear. We have to have the instruments to be able to guide the sectors that open up, because when we deconfine, we also have to have guides who are prepared with the CNEST. And it was decided like last evening, and then it can be announced in the afternoon. Sometimes it's not at the press conference. It can be by the secretarial minister that it's announced. And to be even more clear, because I like clear things, let's say that Monday we agree so that in a week we reopen campgrounds. Well, if we announce it on the Monday, it's in 7 days. If we announce it today, it's in 5 days. But that's how it happens. And usually the ministers look forward to making announcements. You're going to see this afternoon. So it's rarely something that takes a lot of time once we have the authorization. But if you'll allow me, I do have a message to pass to the public, if you'll allow me. Look, we've made a big sacrifice. Everyone locked themselves in. We made a big economic pause to make important gains, and I think that we got them. Unfortunately, there is that unfortunate situation in CHSLDs which took place, but we avoided a lot of impacts on our healthcare system. We freed beds. Everything right now is making it that we want to come back to a normal life. Everything, even we, Maybe we don't wash our hands as often. Maybe we go outside more. Maybe we feel like having gatherings. We deconfined. In the region outside of Montreal, things are going well. In the metropolitan area, things are going pretty well as well. Numbers are going down. However, everything is very fragile. And when I say fragile, it's very fragile. Just a 10% of people, 10% fewer people that apply the guidelines, it would completely change the curve. And instead of it going down slowly, it might go up quickly. So I invite all Quebecers to take that into account in every sector, in every age, to respect the guidelines. I'm telling you, I would be the most unhappy person to have to recommend to the Prime Minister that we have to close things back down because we didn't have enough discipline, everyone together. And that means that if you are outside and you go to stores, wear a mask, keep the 2-meter distance, wash your hands. I know that it's easy and I'm repeating it, I'm rambling. It sounds like I'm crying wolf, but we have to maintain distancing. Look, today, it's hot. We authorize the opening of certain pools and of splash pads because we don't want people to die of heat at home. We want them to continue to respect the guidelines in the case of scorching days, to go cool down and all that. But it can't be like that anymore. We can't end up, 4 families in a splash pad, everybody stuck together, crammed one on top of the other. No. And the buttons have to be disinfected as much as possible. I just want to repeat it. It is particularly important in the metropolitan area where truly I don't want that the drama that we experience in CHSLDs ends up because we have too many people at the hospital and too many people in intensive care. I know that it is not nice to hear. I know that it's a killjoy thing to say, but it's essential, and our ability to remain the sequence of the sectors is going to depend on reactions. What we do today, we're going to see in 15 days, and that we have to be prudent with. That's why we're going per phase. That's why, we can't deconfine everybody right now. And I would say we're pretty quick, compared to some might want. I'm comfortable with what we're doing, but only as long as we respect the measures that we've given to you. Wash your hands. Remain with your physical distancing. Wear a mask, everyone. And if you see people who are too close to you, tell them. Tell them Dr. Ruda says, push yourself to one side. Because it's major. The more we give the virus the probability of replicating, don't forget, 1 case generates 2, that generates 4, and then we end up with an R not above 1, and it'll be the escalation. I'm really sorry to be able to be coming back to that like a wet blanket, but for me it's absolutely essential. Otherwise, we are all going to come out losing. We still have 1,378 people hospitalized in Quebec, and in the past week it has decreased by over 100, about 150, 160. So we are, going down the right road, but we do need everybody's collaboration. And I just want to say a word because it's been a few days that I wish to say it quickly. Thank you to people that we haven't thanked yet, nutritionists and dietitians, because they play a very important role. There's 1,200 of them in Quebec, and they take care of the food services for people who are hospitalized in intensive care as well, in CHSLDs, in different environments. I salute them, as we saluted many professionals, many employees, orderlies, etc. in the network. It's important that we also salute our people who are still working so hard in our network to care for the people who are hospitalized. We hope that the hospitalizations are going to continue decreasing thanks to you, thanks to the public. Hello, all 3 of you. Dr. Arruda, since you were talking about it, my question had to do on that. The deconfinement is in high gear. Would it be possible to have measures of the transmission index in the community, and not that you're talking about, but from Montreal, Quebec? What is it right now? Listen, the information that we have, and there'll be other presentations, the R0 is still below 1 in the metropolitan area, but very close to 1. And I would say that the discussions that I had with Dr. Drouin about certain hot sectors in the northern area of Montreal show that there is a downward trend of community transmission. So we are in the correct perspective. We're testing more, so we're going to find more cases. We test contacts and symptomatic cases more, so we might be able to better contain outbreaks. We have areas like work environments where there were a few cases and they're being contained. So we are going down the right road. But since it is close to 1, when we look at a 10% lowering in the respect of social distancing, which could take place, that's why I'm saying, if you go into a business, you're going to be tempted to go touch things, to get close to people. If the business hasn't necessarily put all the guidelines to prevent you from doing that, I can tell you it's very, very tempting to go back to a regular way of functioning. I've experienced it myself. We end up forgetting, especially now that we're going out, we forget that we're supposed to be confined, and all the reflexes come back. And it's not because people are bad, it's not because we're mean. It's normal. It's anti-normal to stay 2 meters away from other people. People are social creatures. So the R0 is not yet at 1. It's just below 1, but it can go up very quickly. And in our models, we will have, elements that will take distancing into account. And in other regions as well? In regions, things are going well. I would say that the R is low. I don't have the exact number, but it is lower than in Montreal. Things are going relatively well. And I must say, go well, that doesn't mean that there's no cases and no transmission. There are CHSLDs in Quebec City that have had infections, but the situation is under control and the community transmission is adequate. It could happen at some point in a business that there's a small outbreak, but we contain it. Here we are in an adequate mode. But imagine gatherings of many families, for example, or environments where we have difficulty contact tracing. That'll be something. Campgrounds are going to open. Maybe, I don't know. One day. But the gatherings that could come, we really would have to get organized for people to respect that element. One of the reasons why we are decreasing is volumetry, but also the probability of close contacts between people. And there are contacts where it's a lot more fun to do it. And I understand. I like it too. But we can't. We can't. We can't. My second question for Mr. Legault, to be clear about the air conditioning, because it does seem to be an important issue. You said that there were still doubts, but were there clearly indications that public health was deordering the installation of air conditioning? No, we did not have that indication, how you're saying it. But we are in a new situation, and we have to take that into account. The spread of the virus. So it was fundamental to wait for the recommendation of the public health authorities on that. And as we were saying, you remember in what situation we were in April? We had a lot of issues to deal with, and we took more control over those. But what I can tell you today is that we are proceeding very quickly. And those establishments that do have air conditioning right now, everything has started, with, the air conditioning in the rooms where there already were, and that exist in the hallways, in the cooling zones. All of those have, they're on. But we want to go further. And with the minister responsible for the elderly, we want to work so that very quickly, because everything is being done quickly right now, as of the 1st of June, we have an establishment plan that is going to start, and we have many different ways of doing things. Within the establishments, there are different systems that I'm not going to, go down the list, but they are known. Systems that we can put in from the outside with a generator. We're also examining other possibilities as well. So I can tell you that we are confident that this year in Quebec, in CHSLDs, air conditioning is going to be optimal.
Monsieur le Premier ministre, Madame McCann, Dr. Arruda, je veux vous mettre au fait d'une situation.
I would like to tell you about a situation that a few people talked to me about, and I have an email from a person who is pretty affected by a situation. He says, my father is at the end of his life after a long fight against cancer of the esophagus. The doctors are saying he's not going to make it through the summer. Every morning, we hope that his state maintains so that we can keep him at home, because we want to be able to hold his hand until his last breath. Basically, what he's saying is they want to keep him at home as long as possible, because if that person ends up in a home for the end of his life, well, he won't be able to, he's going to die alone without having the privileged contact that they want to have with their loved ones. So what it says here is the rules are clear in those homes. The fin de vie, no more than one person at a time for a maximum of 3 people per ill person. Every day, my heart breaks when I hear that there's opening a store, day camps, the deconfinement that is going well, but what about those homes for people at the end of their lives? So is it possible to loosen the rules so that those people be able to have contact with their loved ones? These are situations where we really have to show a great deal of empathy. I'm going to say it right away because it's really not easy. But we have already lightened the rules, if I can say it that way, because at the beginning it wasn't that. You'll remember they would open the door for one person only, and even at the very, very end when the person was no longer conscious. So we changed everything. But I want to say, the longer the person can remain at home, the better. And we want to offer as many services as possible so that people do stay at home until the end of their lives. And of course, if we can have the information on that situation, we'll see what we can do. Because home care to the end of somebody's life is what we are targeting in Quebec. That is the best place to die, with your loved ones. So I would say that is the first option. So if the family seems to be ready to have that person at home, well, that home for care at people's end of their lives, we could see with public health, because, we've evolved a lot. As I was saying at the beginning, for visits and all that, it was very, very limited. And now we've opened up more gradually. Do we need to go and work on it again? I'm open to that with public health, certainly, but also the option of home care with the appropriate care so that the person can stay with their loved ones. That is also another option. Yes, we're going to have a look at that, Mr. Minister, because both my parents have died, but I can tell you that I also get emails of that kind, and it breaks my heart every time because I'm not sure that I myself would be able to tolerate such a situation. I imagine that I wouldn't even perhaps comply. So we're going to try to see within the context of deconfinement to allow people to also not wait to the very, very end when people are not even conscious anymore. And if we can offer more home care in a context where the family can do it, because it's not always the case either, and sometimes the family prefers that it be in palliative care, we'll have a look at that.
Non, je m'excuse, Monsieur Lacroix, en sous-question.
My question is for Ms. McCann. We're talking a lot about the second wave that is coming, possibly in the fall. It seems that there will be no doubt that there will be an increase in cases. Where are you at in your plans to prepare for this second wave? Because we know that the first wave arrived without warning. But now we know that it's probably going to come. What are you doing? What has been set up? Is there a team that is dedicated to the preparation of the second wave? Yes, certainly. We have a plan and we've started. Everything that we're doing right now prepares us for the second wave. And what has to be said is that we've learned a lot in 2 months. We know what to do, but now we have to do it. And we have started, as at the beginning of the pandemic, to do those things, to prepare a network to improve it. The first thing is to have the staff. That is the priority. As the Premier was saying, we have to hire those 10,000 people. We also have to give vacation, and as I said, 2 weeks off to all of our staff so that they be better rested. And also, all the training for PPEs, wearing them, preventing infections, the hot zones, the cold zones, with the required staff, will be much better placed this fall. And I would say that the more we go forward, the better prepared we are every day. We are in a better position every day. Of course, I don't have the time to tell you everything that we're doing in the network right now to prepare ourselves for the second wave, but especially, our front lines, the medical clinic, and I'll talk to you about it at some point. I think that we are setting up a way of doing things in terms of access to the front lines and first lines to make it that, as we can already see, people don't go to ambulatory care so much. They call their doctors. That helps a lot. Our hospital sector, we have planned the number of necessary beds for a second wave. Normal wave, let's say it that way, because we can't, know how big this wave is going to be, but we have planned for the number of beds in the hospital sector. We are going back to elective surgeries, and here as well, our plan is going well. But of course, we always say it, and I'm going to say it again, we count on the population that they follow the guidelines, which you all know, the 2 meters, etc. That is what will make it that we will have a second wave that will be less severe in the fall. And we already are preparing the vaccination operation against the flu as well. English now.
To all of you. Premier Legault, you said that you weren't taken by surprise when you read the Army's report about CHSLD. But in reading the report, you can see that, of course, we knew it was a perfect storm. As the Premier of Quebec, what's the hardest for you to read between the lack of personal staff members or the lack of training of workers that probably made things worse?
Okay. Like I said many times before, since many years, we had a shortage of about 10,000 employees in our CHSLD. Long time ago. When I came to the government, I increased the budgets for the CHSLD, but unfortunately, and maybe it was an error, we didn't increase at the same time the salaries in order to attract those 10,000 people. So the crisis didn't start with good footage. So right now, I think that what I read in the Army report is that we have shortages of employees. As you know, we've hired via Je Contribue 10,000 people and soldiers. And those people, they are not trained to know how to put the equipment on, when to change the equipment, when you go from one patient to the other. So even people from the Army, some were infected because they didn't wear correctly the equipment. So we understand that the lack of personnel is not helping with the protective equipment. I also understand, and it's coming a few times in the report, about making sure that the same people, they don't go in hot zones and cold zones. But of course, when you're short of staff in each CHSLD, you cannot ask for people to work only at one place. So it's improving, but still it's very tough. So I think, of course, it was like a perfect storm, like you say, because we had 10,000 people missing right at the beginning. And of course, on top of that, some of the employees were infected, and we have another 10,000 that are absent. So it's not easy for sure. That's why I've asked Mr. Trudeau this morning if we can keep people from the Army until September 15. We're trying to get 10,000 people that would accept to be paid, to be trained in the next 3 months and start working in September full-time. These people would be paid $760 a week during the training and $940 a week after, if they succeed with their training.
In talking about Prime Minister Justin Trudeau, he wants to raise the question of long-term care facilities. The federal government wants to help. You're saying money, that's it, no more. But you're not in a position to say money. Like, you're in a fragile position, Mr. Legault.
We have a unanimous position, all the premiers of the different provinces. We're not happy about the fact that the federal government used to finance 50% of the healthcare expenses of the provinces. They now are between 20 and 25%, depending on the provinces. In Quebec, it's 23%. So what we say is that we know that every year, expenses to keep the same services, they increase by over the inflation. And right now, on top of being at 20 or 23% of the total financing, Mr. Trudeau wants to reduce from 5% increase a year to 3% increase a year. So all of us, the different premiers, were telling Mr. Trudeau, if you really want to help us in long-term care facilities, please increase your transfer in health to all provinces. Then we'll be able to hire, pay better, and have more staff in our long-term care facilities. And all the premiers are saying that.
Next question, Philote, Montreal Gazette.
Question for Mr. Arruda. I was interested in your comments that the R naught in the Montreal area, you say, is close to 1. And yet you also said that 10% of people not respecting the rules can throw things out of whack.
Exactly.
You made models of projections of how the virus would evolve. Can you tell us, do your models still hold for the month of June in Montreal and in Quebec overall, given these two things that you just said? Are your models still reliable for what you see?
You know, models are always models. Models are always the limits of the quality of the data we can have, that there is not perfect quality of data. And even the people from scenarios will always tell you at the beginning, it's scenarios and it depends on a number of factors. But actually, we still are in a position where if everybody does what we want to do, keeping some distancing, even if we are deconfined, it doesn't mean you go back to the way you lived before. It means that you will wash your hands, you will keep the 2 meters distanciation as most as possible, especially with other families. Okay, you will use a mask when you're going to go to stores because there you will have normal reflex to do exactly what you did before, is to go beside somebody to take that pair of pants, and so you will wear your mask. And if people keep that, we won't have these outbreaks in the community that will make the R0 go up. And then when the R0 goes up, it means that each case, actually R0 near 1 or under 1 means one person infect only one person. But if we go with more communication and no distanciation, one person can infect 2. The next 2 can infect 2 other more, and it's when you get this exponential thing. And then that will mean that even if it's young people or there is still elderly people not have been doing the disease, those can be attacked. And what we have seen in CHSLDs could happen in a tension in our healthcare system. It was what we did well before. I'm not talking about CHSLDs, I'm talking about in the community. We didn't have that pressure that we have to choose between this guy and that person for getting access to hospital or even having the respiratory in ventilation-centered care. So it's why I'm telling, everything is going to open gradually, but please respect those conditions. It's very important. Even if you go in vacation, try to stay with your family, try to respect no more than 10% together, but from 3 families. Because the more you are with somebody else coming from another story, it means that you're at higher risk of getting somebody who don't know, who is sick and can transmit you the disease. The virus is still there. The virus, even if it's sunshine, even if it's a wonderful summer, is still there.
Second question quickly for Premier Legault. We've been in this room many, many times, and you've begged to get more workers in the CHSLDs. You're launching another campaign today for 10,000 more. what happens if you don't get the people you're looking for, and then we get into a second wave? You've asked for the Army to stay till the September 15th, but what happens if you don't get the people you need?
Okay. But, during the last 2 months and a half, what I've asked is people to come on a temporary basis. So we've got those people who accepted to come on a temporary basis. Same thing with the people from the Army. What I'm asking today is different. I'm asking people who would like to work full-time, accept to be paid during a 3 months training, and because it's important, we settle once for all this problem of shortages. So that's what I'm asking. If it doesn't happen, but of course, I hope that the 10,000 or 9,700 people that are still absent, that they come back as soon as possible. I hope the Army stay there until we finish the training. So try to find other solutions on a temporary basis. We may ask employees of the government to go and work in the CHSLD for a few months. But really what I would like is to settle once for all and get those 10,000 full-time trained people.
Thank you. Next question, Samuel Pouliot, CTV News.
Good afternoon. Mr. Legault, there's a Laval air condition company that reached out to Marguerite Blaire's office in April. You've explained it a little bit in French earlier, but they wanted to go into CHSLDs to install units. The government didn't give them the access, and now they say they are weeks late in their schedule. Is it now too late, and are there any guidelines to follow so COVID doesn't get recirculated?
Okay. There were at least two reasons not to answer positively to those people who would like to have installed in April the air conditioning in certain residences. First reason to say no was the fact that we didn't want to get more people coming in and maybe bringing the virus into the residences. And the second reason is that it wasn't clear at the time if there was not a risk of putting air conditioning or ventilators, that it would not bring more virus from one resident to the other. So now, and still, there are some risks to do so, but we think that we have more advantages than disadvantages to do so now.
And how and when will the government help the vulnerable cultural sector to have a guideline on reopening? Because they are worried right now.
Okay, but two things with the cultural sector. First, soon, we hope that we'll be able to register some shows and show them on TV or on computer. Of course, they would like eventually to put some people to in the room to see shows. It's not tomorrow that we'll get the okay from the public health sector. It will probably need months before I get this okay. And even when we'll get the okay, we'll have to respect the 2 meters. So there's no way that you'll be able to go over 50% of the capacity. So I understand that it's tough for these people, but we have to protect health first.
Very much. So 2 last questions from Raquel Fletcher, Global News. It's for Mr. Legault. Dozens of Canadian military personnel have now tested positive for COVID-19 after moving in to help in long-term care facilities. I'm sure you can appreciate now that this report is out. How difficult is it for them? What is your message to our men and women in uniform working in our CHSLDs?
But my message for men and women in uniform is thank you. Thank you very much for coming. I know that the situation is tough. We're happy to have you. We hope we continue to have you for months. of course, it's not easy, like it is for new people coming in, to know exactly when to wear a protective equipment. So it's not easy for somebody without any training to know how to wear the equipment. It's not easy also from a guy or a woman from the army to know how to wear and when to wear this equipment. And unfortunately, we had some of these people who were infected.
And as a very last question, a few days ago, you said that you have not forgotten about restaurants and bars. When can we expect a timeline for these to reopen?
But we are in discussions. Of course, first thing we want to do gradually. So we want to go gradually. So we first need a couple of weeks to know what is the impact of what we already reopened. Then, with those figures, sit with public health and see which percentage of the capacity that can be filled in different restaurants eventually. But we're not there yet.
Thank you very much. Donc, c'est ce qui complète pour cette conférence.
So this puts an end to the press conference. Thank you.